Welcome friends to the third video series on teaching approach. In this video we are going to discuss about the behavioral approach in teaching children with intellectual disability. So you all know like a behavioral approach focuses upon the behavioral theories which facilitates children with intellectual disability to learn new concept or to maintain the learned skills. So in this video on behavioral approach, we are going to focus upon two approaches, that is applied behavior analysis and discrete trial training. So let's understand what is adaptive behavior analysis, that is shortly called as ABA. So ABA is a type of therapy which focuses upon improving specific behaviors such as social skills, communication, reading, academics, as well as adaptive learning skills such as fine motor dexterity, hygiene, grooming, domestic capabilities, punctuality, and job competence of individual with intellectual disability. So, apart from the general developmental skills, adaptive learning skills are also taught through applied behavior analysis for children with intellectual disability. So, applied behavior analysis is defined as a process of systematically applying intervention based on the principles of learning theory to improve socially significant behaviors to a meaningful degree and to demonstrate that intervention employed or responsible for the improvement in the behavior. So, ABA is a systematically applied intervention which is based on the principles of learning theory in order to improve the socially significant behavior of a person. So, applied behavior analysis is a scientific approach to understand a behavior. So, ABA principles focus on how behaviors change or affected by the environment in which the individual survives, as well as how learning takes place in the environment. So, in ABA, behavior of an individual is observed and based on that behavior, whether that has to be maintained or new behavior has to be taught, will be done based on the set of principles which mainly focus upon the desired behavior change in an individual. So, the ultimate aim of ABA is to establish and to enhance the socially important behavior which is very much required for an individual to live along with the members of the society or the community. The principles of ABA are, there are four principles. The first one is to teach new skills which the individual previously did not have. Like that particular skill is very essential for his social living and the individual has not yet acquired or learned that new skill. So those skills are being taught. The second one is the child or an individual has that behavior but occurs rarely and it is not happening all the time. So increase positive or more socially acceptable behavior. So the frequency of the occurrence of the behavior has to be increased. That is the positive behaviors. Then the learned behaviors, that is the learned positive socially acceptable behaviors are to be maintained. It is not like learned today and forgetting tomorrow. So the behavior has to be maintained at the same level for benefiting the individual to live like any other person in the society with all requisite social skills. Then the learned behaviors has to be generalized. So a behavior would have been taught in a classroom setting or on a one-to-one basis. That behavior has to be successfully transferred to the environment. So like environment in the sense that has to be applied in the real life scenario. So those behaviors has to be generally transferred from one environment to the other environment, that is from school to community, or from one particular person to all the person. Not like if that behavior happens only with the teacher, that has to be extended to all other members in the society which are relevant for the occurrence of the behavior. So these are the 4 principles of ABA: teaching new skills, increasing the positive behaviors, maintaining the behaviors, and generalizing or transferring the learned behavior from one environment to the other environment and from one person to the other person. So here ABA uses careful behavior observation that occurs in an individual, and using positive reinforcement or prompting, the next step of the behavior is being taught. So here an individual is observed for the occurrence of the behavior, and we will that will give a feedback like whether the behavior exists or not, whether that has to be increased or not, whether that has to be maintained or that has to be generalized. We will get to know, is it not? So based on that, if that has to be taught or enhanced or to be maintained or to be generalized, reinforcement, that is the positive reinforcement or prompting, will be used to teach the next step or the each step of the behavior for its completion. So whenever the child performs that activity as expected, he or she will be rewarded with positive things, and reward list will be prepared by the teacher based on the priority of the child. Reward will be given for the occurrence of the behavior in a smooth way. Then undesirable behaviors may also be observed in that individual, that will interfere with the learning of many things and also the social skills. That has to be watched closely and observed. So based on the observation, we have to determine as a teacher what happens to trigger a behavior and what will happen after the occurrence of the behavior, and which stimulates or reinforces the occurrence of the behavior has to be found out. So why we are doing all these things? We are doing this to remove the triggers from the environment of the child. So definitely the undesirable behaviors has to be removed. Why? Because that is an obstacle which interferes with the learning of the child. So in order to remove that or to fade out the undesirable behavior, that has to be closely observed, and through observation the trigger which reinforces the occurrence of the behavior again and again has to be found out, and steps has to be taken to remove the triggers. As the positive reinforcement is used to teach desirable behavior, here something would have acted as a reinforcer for the occurrence of the undesirable behavior also. So that has to be found out, and that has to be removed from the environment of the individual or the child. So the new reinforcers has to be identified, and that has to be used to teach different behavior which is desired in that environment with the to elicit good response to the same trigger among the children with intellectual disability or children with developmental delay. So, ABA treatment includes several established teaching tools, which includes discrete trial training, incidential teaching, pivotal response training, fluency building, and verbal behavior. These are the different teaching tools which are used for applied behavior analysis treatment. Among all these things, we will be discussing about the discrete trial training in the forthcoming slides. So here, ABA treatment, how it works is, like we have to select a positive reinforcement which stimulates or reinforces the child to make the child to do that desired behavior. That has to be used systematically, step by step, so that new behaviors are taught, desired behaviors are increased, and to maintain that behavior, that is the fluency building, and also to generalize the behaviors. And then comes a discrete trial training, which is a part of ABA. Here we have to keep in mind that DTT and ABA is not the same. DTT is different and ABA is different. DTT, to be very clear and specific, is a part of ABA. But DTT never becomes the synonymous of ABA. This is a part or one of the tool or the method which is used in ABA analysis. So here DTT is one-to-one instructional approach which is used to teach skills in a planned, controlled and systematic manner. So here DTT is used to teach desired behavior to an individual in small repeated steps which are previously planned in a controlled environment and a systematic manner. So here each trial which we use in DTT will have a proper beginning and end. So here in DTT, the use of antecedent that triggers the occurrence of the behavior and the consequences which we expect to happen are carefully planned and implemented. So this is what is planning and controlling mean. DTT will have a definite beginning and end. Beginning is also planned, that is the antecedents, and the end, that is the consequence, is also planned and controlled. So here also the positive praise and tangible rewards are used to increase the occurrence of the desired skills or the behaviors. So here in DTT also, data collection is very, very important for making decisions. That is, we are planning the beginning and the end, that is the antecedent and the consequence. So that for planning that, we should have supportive data to plan in a proper way. So data collection becomes very, very important for progress, skill acquisition, maintenance and generalization. And the best thing of DTT is simple steps, teaching in simplified steps. So here the skill is not taught in taught as a whole. Here the simply based on the steps, like one step will be taught, then based on that, keeping that as a base or foundation, the next step will be taught. So here in DTT, one step will be taught at a time, and based on that step, the other steps in the behavior will be taught. So the main thing of DTT is we use a plan, controlled and systematic approach in simplified step to make the child to learn a desired behavior, to maintain the behavior and to generalize the behavior in the environment. So Here, this DTT was developed by Dr. Ivar Lovaas, which began in the year 1980s, which is a highly structured method of teaching skills by breaking them into smaller teachable components. So here, this DTT can be used to maximize learning of skills, which includes cognition, communication, play, social and self-help skills. So, 5 main techniques are involved in DTT. Those are, the skills are broken down into teachable components. Then, each skill are taught until the mastery is attained. So, an activity is broken down into teachable components and each step is taught until mastery is attained in each step by that individual. Then intensive teaching sessions will be conducted, then using the prompts as needed, and the child cannot rely on the prompt all through the life. So the prompts will be used until the child will get or attain mastery, and slowly the prompts will be faded, and the reinforcement strategies will be used to increase the skills. These are the 5 main techniques which are followed in DTT. So, we have been discussing from the beginning of DTT that breaking down the skills into teachable components or simplified components is the key of DTT. So here, it depends upon the 3 key areas, that is discriminative stimulus, which is called as SD or antecedent, and response, which is called as behavior, and the reinforcing stimulus, which is called as the consequence. See, we all know the learning theories, and the learning theories, they operate upon this reinforcement and the which is being used, or which being act as a stimulating factor for the occurrence of the behavior again and again. So here, let's take an example. If you are asking the child to touch the head, that is what we desire, is it not? So the discriminative stimulus, antecedent thing which stimulates that particular activity to happen in the child, we will instruct touch your head. The expected behavior is the child has to touch his or her head, is it not? The child performs that behavior. Then reinforcement or error correction. Reinforcement is, that's right, you did it, earned the car. The child is positively reinforced. If the child has not done that, then error correction has to be done. Again, the antecedent will stimulate the child to perform that behavior based on the consequence. Again, so the cycle will be repeated until the child attains mastery over that particular behavior. So these are the 6 possible part to a discrete trial which we were discussing earlier. That is antecedent, prompt, as a result of that response, then consequence for the correct response, consequence for a incorrect response, then intertrial interval. See, that is being explained in this picture. Antecedent is the child has to copy the teacher. Correct response is rewarded. Incorrect response is not rewarded. That is what is error correction. So once that error correction is made, the child will slowly learn through the antecedents and will begin to give correct responses. So these are the 2 behavioral approaches which are mainly used among children with intellectual disability or developmental delays to teach new behaviors, to increase the occurrence of the behavior, to mainly to generalize the behavior. So why? Because see here, children with intellectual disability are taught new skills which they have not yet learned according to their developmental level or according to their level or ability because of their limitations. So that has to be taught, and even if they have learned a few behaviors, that may not occur in frequent intervals, like due to the unavailability of opportunity or proper motivation also. So that has to be increased and maintained and applied in a day-to-day situation, so that the child will be learning on par or near normal up to the level of their age appropriate peers. So this behavioral approach facilitate the learning of individuals with intellectual disability in a positive manner.